it's amazing to me whenever somebody has taken the courage to come in and share their story. It's I feel very honored and humble actually whenever somebody comes in to, let me know what's going on in their life. Because this can affect like intimate relationships, just even affect people, how they feel about themselves. So it's a really open conversation. Genitourinary syndrome with menopause.
Okay.
So what this is that women, we start to lose collagen just like as we would do our skin and our face and our bodies. But the thing is that we can see these little changes happening, but we don't often see what's going on in there. And going into our 30s, like we are starting to lose the ability of producing that amount of estrogen, so we're not stimulating that collagen response as much as we would, and just slowly over time you start to see changes. So I think the two main concerns that people have whenever they come into me is stress incontinence and vaginal dryness. Vaginal dryness, of course, then can lead to discomfort during sex, persistent urinary tract infections, lack of lubrication. All of that can really affect intercourse. Stress incontinence, of course, that can affect a woman's quality of life depending on the severity. The reason why diVa is fantastic at treating both of these conditions is because of its dual wavelength technology that works at the same time. It's the first hybrid laser to be used during vaginal rejuvenation. So one laser is going deep into vaginal tissue and it's stimulating collagen. So we are redensifying and thickening and stimulating that tissue to act in a healthier fashion. So blood supply then is rushing in, which is bringing nerve response with it. And then the other laser is resurfacing and taking away some of that dead tissue. So we're completely having a full cellular turnover. Well, actually, when I get feedback off my clients, every time they come back in for the diVa internal approach, most will see changes every time they come in, which is amazing. It really keeps them positive and, and that something that there is that change. It is done in a series of 3. So, settings obviously get more progressive as the tissue is thickening and getting healthier. And that's done every 4 weeks. Whenever I chat to my clients about maintenance, I leave it that when they feel that there's symptoms returning, that they feel free to come back into me. Typically, we may say 1 a year of diVa, but it really does depend on age, it depends on hormones, it depends on what is going on for that individual. And we have some patients coming back, yearly for their maintenance treatment. And then some people, it's just really left on them just to come back whenever they feel symptoms. Well, if we were talking about vaginal health, that is where diVa really is the best option. But then, you can come into the aesthetic world of vaginal health and sexual health. And the labia majora, which is the outside, can lose a bit of volume. And then that would texture, may be an issue. And so we have diVa Tight as well. So we can do that in combination with diVa. So that is stimulating collagen as well within that majora. So you can actually see a visible lifting and kind of just redensifying the area. There's also, what we have been doing as well is that some people, they will suffer from hyperpigmentation as well. Some people just may not be happy with the texture and do want a little bit of tightness. So there is other devices, and I have been using Halo on the labia majora as well in combination with diVa Tight to get kind of like the full 360 rejuvenation. We do perform labiaplasty here as well. So if somebody finds it was the minora, which is the inner, and if they find that was longer than they wish for, or just, maybe through childbirth or for whatever reason they were unhappy or wanted to chat with somebody, that's where, a surgical intervention can come in. So researching your technology, and I think that's why diVa comes out on top, is because, you do have the benefits of both lasers. It is the only FDA-approved device to treat GSM. And the other thing is actually your treatment provider and the place that you're coming to. You're making sure that they can devise a a plan and the treatment that's right for you. And looking into maybe the experience, maybe the amount of treatments that they have performed, I think is also very important as well. I think it's very important that the patient themselves does due diligence by looking into all of those into the background. Some women are coming with very sensitive concerns and want to share their stories, so you want to be able to do it in a safe, supportive environment. It's not just about treating this issue, it's also looking into the background and taking care of the client as well.